Depressive Disorder and Suicide in Adolescents by Rachel Milone and Kimberly Vitcor. There's actually two types of depression: persistent depressive disorder and what most people are referring to when they're talking about depression, major depressive disorder. Major depressive disorder is mainly characterized by sad mood or loss of interest in activities that they previously found enjoyable. According to the DSM-5, in order for someone to be diagnosed with major depressive disorder, they must exhibit at least 5 of the 9 symptoms. Those symptoms include depressed or irritable mood close to every day. Typically, in children, depressed mood is seen as irritable mood. Decreased interest in pleasure activities, change in weight or eating habits, change in sleep patterns, change in physical activity, fatigue or loss of energy, feelings of worthlessness or guilt, inability to concentrate, and suicidal thoughts. There has been secular increases in the 1-year prevalence of major depressive disorder in adolescents. Alternatively, the other depressive disorder is persistent depressive disorder. Persistent depressive disorder, previously called dysthymia, made its first clinical debut in the most recent DSM, the DSM-5, which was published in 2013. Today, any adult who experiences clinically significant depression for at least 2 years can be diagnosed with persistent depressive disorder. But for adolescents and youth, clinically significant depression has to be experienced for only 1 year for persistent depressive disorder to be diagnosed. The previously used term, dysthymia, was used for someone who was experiencing these symptoms of depression for 2 years, but not in severe enough form to be diagnosed with major depressive disorder. But today, as the current DSM-5 states, persistent depressive disorder can be used to diagnose anyone who experiences depressive symptoms for more than 2 years, but 1 year in adolescence, whether or not it is severe enough to be classified as major depressive disorder. Although depressive disorders, and specifically adolescent depressive disorders, have been primarily studied in the United States and the Western world, the World Health Organization has ranked depressive disorders the 4th leading cause of disabilities worldwide. Depression is a common illness worldwide with more than 300 million people affected. This number is only increasing as the World Health Organization predicted that by 2020, depressive disorders will move up to the 2nd leading cause of disability worldwide. This is especially prevalent for adolescents, as the percent of adolescents who have experienced depressive episodes within the last year has increased from 8.7% in 2005 to 13.2% in 2017. In countries of all income levels, barriers include lack of resources, poorly trained healthcare professionals, and the stigma associated with mental health disorders. In all countries, people are often misdiagnosed or misprescribed. Although there were some writings about depression all the way back in the 2nd millennium BC, in 1917, Sigmund Freud began talking about the recently discovered illness of depression. Freud believed that depression was the result of self-hatred that stemmed from the loss of something, this loss being physical loss, such as the mourning of a loved one, or symbolic loss, like failure to achieve a certain goal. Others during this time thought depression was a brain disorder, and doctors performed surgical procedures called lobotomies in an attempt to cure these patients. These unsafe procedures often led to permanent neural damage and death. By the 1950s, doctors began understanding both the biological and environmental components of depression. Drug therapies were beginning to be developed in addition to psychotherapies that were being used. Today, most people understand that depression is a result of many biological, psychological, and social factors, but the specific causes of depression are complex and not yet understood. Doctors today decide on treatment for a patient based on the biological, psychological, and social factors and how they affect and interact with each other. Unfortunately, no single treatment has been found to work on everyone, but both psychotherapies and drug treatments are commonly used to treat depressed patients. Depression and mental health as a whole are becoming increasingly understood in America and many other countries. Increasingly, the population understands how mental health affects all parts of the life by impacting an individual's ability to function at home, work, and in the world around them. In adolescence, depression is often underrecognized and undertreated, as close to 75% of adolescents go without treatment. Also, with an increased understanding of the importance of mental health comes an understanding of the risk factors associated with suicide. Depression is a major risk factor of suicide for all age groups. Untreated depression in adolescence is associated with adverse outcomes in adulthood. These adverse outcomes include poor physical health and decreased educational attainment. The fact of the matter is that some adolescents affected with depression commit suicide. Approximately 4,600 youth ages 10 to 24 lose their lives each year to suicide.
Okay, so so many studies have been done on the causes of depression and other internalizing disorders in adolescents. Most experts support the diathesis stress model of depression. So the diathesis stress model the name was coined in 1987 by researchers Spielman, Caruso, and Glavinsky. And so it basically says that depression occurs in adolescence with a predisposition to it, which is the diathesis part, when they're being exposed to stressors, which is stress. So the diathesis means that depression has a strong genetic component. So an example is that depressed adolescents have a 3 times more likely chance of becoming depressed if they have one parent that's depressed than adolescents who have no parents that are depressed. And also, some of the stressors can be environmental influences, such as family structure. So if one's family has a lot of conflict or they're not cohesive, then that could lead to stress that can induce depression. Also, adolescents who are unpopular and have other friends who are depressed could create stress. In addition, a lot of people who get stressed have a lot of chronic and acute adversities. Studies of adolescent depression. Many studies have been done on the causes of depression and other internalizing disorders in adolescents. Most experts support the diathesis stress model of depression. So the diathesis stress model says that depression occurs in adolescents with a predisposition to it, which is diathesis, when they are being exposed to stressors, which is stress. So the name diathesis stress model was coined in 1987 by Spielman, Caruso, and Glavinsky. So the diathesis part basically is highlighting that depression has a strong genetic component. An example of this is how adolescents with a parent who is depressed is 3 times more likely than to develop depression than an adolescent who does not have any depressed parents. So the stressors part basically focuses on the environmental influences that can affect depression. So family structure, which basically means how the conflicts and how cohesive the family is. In addition to that, another environmental influence is adolescents who are unpopular and have friends who are depressed are higher likely to get depression. And the last one is a lot of times adolescents who are the most at risk for depression have or undergo chronic and acute adversity. So studies of adolescent suicide. The Center for Disease Control and Prevention is an organization that collects a lot of data regarding adolescent suicide. And some of their findings are that female teens are more likely to attempt suicide than males. There were twice as many suicides in the U.S. as homicides, and there's an economic loss associated with suicide, and that economic loss being $50.8 billion, which is 24% of the fatal injury cost. So some things that are still unknown about depression and suicide in adolescents is that there's no definitive explanation for the emergence of sex differences in depressive disorder among adolescents. So before puberty, boys are slightly more likely to be depressed, but following puberty, it flips so that adolescent girls become more likely to become depressed. One possible hypothesis that was created was that potentially the changes in social relationships around puberty may make girls more vulnerable to psychological distress than boys. Another thing that's unknown is what exactly causes differences in suicide and depression in different races and sexes. Suicide and depression rates and prevalence are different between the races and sexes, and it's not exactly known why these exist. And the third and last thing that's unknown is how is depression and suicide manifested differently between cultures. So different cultures have different stigmas and different prevalences, and it'll be interesting to figure out why these exist or how they develop and why in one country it's different than another country. So the significance of depression and suicide is, so for one, depression is the most common psychological disturbance among adolescents, and having depression or other psychiatric problems is one of the risk factors of attempting suicide. So other risk factors include having a history of suicide in the family, being under stress, experiencing parental rejection, family disruption, or extensive family conflict. And having one risk factor makes you more likely to attempt suicide, and then people who have none, and having more than one makes you more likely than all the people who have one or none to attempt suicide. In addition, suicide is a leading cause of death among adolescents. 7.4% of youth in grades 9 to 12 have reported that they have made at least one suicide attempt in the past month, based on the 2017 Youth Risk Behavior Survey. So for parents, what parents should know is that depression and psychological disorders are common in adolescents and they're prevalent issues. Because the prevalence of depression and psychological disorders sometimes happens to be lower in Black adolescents than other races, many Black parents do not believe that depression is a real thing and they push it under the rug. However, it is an actual issue, and kids that have these issues need to be helped through various methods, such as therapy and drugs in adolescence. But most importantly, they need support, and they need their parents to acknowledge that these disorders exist. Secondly, what parents should know is that anyone can experience depression and attempt suicide, regardless of their gender, race, class, intelligence, or achievements. And 8 out of 10 of the people who are considering suicide give some sign of their intention. So staying involved in adolescent's life and knowing the signs, for example, verbal suicide threats and giving away prized possessions, could be the difference between life or death and helping your child. So what youth should know is that there's a difference between just feeling sad and actual depression. So depression needs to be accompanied by other symptoms, such as decreased enjoyment of pleasurable activities, pessimism and hopelessness, apathy, boredom, loss of appetite, and difficulty sleeping. And suicidal crises are relatively short-lived, meaning that most people that attempt suicide and survive do not end up dying of suicide later on in life, and 70% do not attempt suicide again. What teachers should know is that school causes stress, and stress is one of the risk factors for depression. the prevalence of depression rises during adolescence, and through education, the stigma surrounding depression and other internalizing disorders can be eliminated. So, in a similar way, so school can cause stress because, and one of the main stressors could be academic achievement, which is especially prevalent in or related to depression in adolescents from Asian countries. And depression is also the most significant internalizing problem that has its onset in adolescence, so within the high school to early college years. And what researchers should know or consider is that media has played a big role in how adolescents perceive depression and suicide, and depression and anxiety treatments and how they're perceived is different in the current media age. So here are some pictures. So the top left picture is showing how social media can negatively affect the emotions of this lady. The bottom left picture shows emojis of sadness that people can send or receive. And on the right, just some facts. So 45% of people feel worried and uncomfortable when not being able to access their social networks. 60% of people feel the need to switch off their phones to have a break. 66% of people have difficulty sleeping after using social media. And 25% of people have relationship difficulties because of confrontational online behavior. So this shows how social media has played a big role in mental health and how it's changed depression and mental health, and how these things were not as prevalent before, but they're prevalent now, and they cause so many things and emotions in adolescents who are extremely vulnerable to these issues. And so suggestions for future research/policy is to further research into what it's actually like being an adolescent in the modern era. So the effect social media plays on depression and suicide should be researched more. And the differences in the rate of suicide attempts in adolescents of different genders and races. What could be the causes and how to deal with this. And that's all. And we're done. Thanks for listening.